everyone, and welcome. If you're gearing up for your phlebotomy certification exam, you already know that nailing non-blood specimen collection is a must. So in this explainer, we're going to break down everything you need to know to handle these specimens like a pro.
Okay, let's kick things off with what is truly the most important concept you need to grasp. This quote, it says it all. The quality of a lab result isn't decided by some fancy, expensive machine. Nope, it's decided by you, right at the moment of collection. Your actions, in what we call the pre-analytical phase, are what make a test result accurate or totally useless.
So here's our game plan. We'll start with the big why, your fundamental role, then cover the absolute non-negotiables of safety and labeling. After that, we'll do a deep dive into urine collection, which is all about timing and technique. We'll finish up by talking about how to protect the specimen after you've collected it, and then wrap it all up with the key points you've got to know for your exam.
So, what is this pre-analytical mandate anyway? Well, it's just the simple understanding that every single thing you do, from how you instruct the patient to how you handle the container, directly impacts the result. It affects the diagnosis, the treatment, everything. Your precision is paramount.
Okay, let's build on that idea by looking at the universal rules. These apply to every single specimen you will ever touch. Think of these as the foundation of good practice. And, they're also heavily tested on your exam.
First up, safety is never, ever optional. The core principle here is standard precautions, which basically means you treat every specimen as if it's infectious, always. This means you follow your facility's OSHA plan, you wear the right PPE for the job, and you handle waste correctly. And here's a huge one for teamwork. If a specimen gets handed to you, you are still responsible for checking that label before you accept it.
And listen, proper labeling is your absolute best defense against errors. I want you to think of it as having 4 essential pillars. You need 2 patient identifiers, like name and date of birth. You need the specific source and type. You need the exact time and date of collection. And finally, any special details or qualifiers. And this has to be done right away, right there with the patient. No excuses, no exceptions.
And this slide right here shows one of the most common and easiest mistakes to avoid. The label always goes on the body of the container where the actual specimen is. Why? Because in the lab, lids come off. They get set aside. If your label is on that lid, that specimen is now a mystery sample. It's unidentified, it's useless, and it has to be thrown out.
So this brings us to a critical point, and it's a major exam topic. If you get a specimen that is unlabeled, or the label is smudged, or it just seems wrong, what do? You reject it, period. You never guess. The only safe, professional, and correct thing to do is to request a recollection. It's all about patient safety.
All right, let's switch gears and focus on the non-blood specimen you'll see most often, urine. And with urine, when you collect it is just as important as how you collect it. The timing tells a huge part of the story.
This table breaks down the why behind the timing perfectly. A random sample? Yeah, that's fine for a basic screening. But if you're trying to detect a pregnancy, you need that first morning specimen because it's the most concentrated. If you're monitoring how a patient handles sugar, you need that 2-hour postprandial sample, timed perfectly after a meal. See? It's all about matching the collection time to the question the doctor is asking.
Okay, let's get into the nitty-gritty of 2 of the trickiest collections, the 24-hour urine and the clean catch midstream. You really need to master these because they're full of potential errors, which, of course, makes them favorite topics for exam questions. Now, the key to starting a 24-hour collection correctly is a little weird. It actually starts by throwing urine away. I know, right? The patient wakes up, voids that first morning urine right into the toilet, and that exact moment is the start time. The clock begins with an empty bladder. From that point forward, every single drop for the next 24 hours goes into the collection jug.
And during that 24-hour window, you have to protect that specimen. The jug needs to be kept cold, usually in the fridge, between 2 and 8 degrees Celsius. This slows down any bacteria and keeps the stuff you're trying to measure from breaking down. The patient has to understand every single trip to the bathroom counts.
The test ends just as precisely as it starts. At that 24-hour mark, the patient voids one last time and adds that to the jug. And here is the absolute non-negotiable rule. If even one void is missed during that entire 24-hour period, the whole test is invalid. The volume is wrong, the calculations will be wrong, and you have to start all over again.
Now for the clean catch, which is super important for testing for infections. The whole goal is to get a sample of what's in the bladder without contamination from the skin. The cleaning part is a little different depending on the patient's anatomy, as you can see, but the main principle is always the same. Start the stream into the toilet and then, without stopping, catch the middle part of the stream in the sterile cup.
So you've collected the perfect sample. Great, but you're only halfway there. The second half of the job is protecting that sample until it can actually be tested. This is all about maintaining specimen integrity, and it's just as important as the collection itself.
You've basically got three enemies trying to ruin your sample: time, temperature, and light. For a routine urine, you've got a 2-hour window to get it to the lab. After that, it needs to go in the fridge. For some special tests, like for bilirubin, you have to protect the sample from light by using a special amber-colored container, because light literally destroys what you're trying to measure. A lot of simple tests, like urine dipsticks, are done right there at the point of care. They're often called CLIA-waived, which just means they're simple enough to not need a full-blown lab. But, and this is a huge exam topic, waived does not mean no quality control. QC is always required.
Run-in quality control just ensures your results are reliable. It's simple stuff. Check the expiration dates on your strips, keep the lid on tight so they don't go bad, and run your liquid controls when you're supposed to. And if that QC fails, you stop. You don't test any patients until you figure out what's wrong and fix it.
All right, let's pull this all together. We're going to do a quick fire review of the most important concepts, the stuff you are very likely to see on your certification exam. This is your final study checklist. Expect to see scenario questions. They're not just going to ask you to list facts. They'll give you a situation. They'll ask, a doctor suspects an early pregnancy. What specimen do you need? And you'll know it's first morning because of concentration. Or, you receive an unlabeled cup. What do? You reject it. You need to know these rules cold.
If you only remember one thing from all of this, let it be this right here. Your job is to make sure that every single result is medically useful and legally defensible. And you do that by handling each specimen type correctly, labeling it perfectly, and getting it to the lab in the right condition. So, as you wrap up your studying, this is the real question to ask yourself. Every tube, every cup you handle, that's not just a sample. It's a person, and they are trusting you to get this right. Your skill, your attention to detail, you are the guardian of that result. You can do this. You've got this.